Hello everyone and welcome to this second video in a series about gestational diabetes. This is not individual medical advice. For that you need to talk to your doctor or midwife. Well, in the first video we tried to find the big fat overgrown babies who are the basis and the foundation for the whole gestational diabetes enterprise. But we couldn't find them. You can go back if you like and have another look at that first video and see if you can find them. In this second video, we're going to look this time for evidence of worthwhile benefits from treatment. We're going to look at studies and other evidence, and I'll tell you my interpretation, but as always, you should look these up for yourself and come to your own conclusion. Well, what does treatment do? You know, it must do something pretty important, otherwise what would be the point? Well, you might have been told that treatment will decrease the chance of stillbirth. You might have been told that treatment will decrease the chance of the mum needing a caesarean section. You might have been told it will decrease injuries to the mother, injuries to the baby, the chance of the baby having low blood sugar levels or blood glucose levels after it's born, breathing problems in the baby, premature birth. You might have been told it will decrease the chance that the baby will be overweight or obese when it grows up, or that the baby will have diabetes when it grows up. You might have even heard that it will decrease the chance that treatment of gestational diabetes during pregnancy will decrease the chance of the mother having diabetes later in life. Well, if you've been told or heard any of these things, it may interest you to know that none of it's true. It doesn't do any of these things. Let's look at the evidence. All right, I've gathered evidence from systematic reviews and meta-analyses, and I'm showing them to you so that you can look them up for yourself, and you should. Meta-analyses and reviews gather together multiple studies on a topic, and they put all this evidence together and summarise the overall results. So you've been having a look at these: Horvath, Falavigna, Hartling. These are a number of the reviews about gestational diabetes treatment, Philsup, Farah. And then there's also a review from what's called the Cochrane database. And this is a highly regarded collection of medical evidence. And I'll show you, this is a review of all the reviews about gestational diabetes treatment. And what we'll do is, first of all, we'll have a look at what the Cochrane review has to say, and then I'll summarise the other studies for you. So let's have a look. Well, here's what's called a Cochrane review, summarising the evidence for treatment. It's from 2018, and the authors conclude, as you can see here, lifestyle interventions, which means dietary changes, exercise, and insulin for some women, means fewer babies being large. That's about it. Not a ringing endorsement, is it? Well, I don't know about you, but that seems to me a pretty brutal assessment of the benefits to be expected from treatment of gestational diabetes. A decrease in babies being large. Well, I think I'll be a bit more generous in my summary of the findings of the meta-analyses, which is as follows. Well, according to all the evidence, there are three things, three things and three things only that are significantly changed by gestational diabetes treatment. Three things. One, we've looked at a restraint in the growth of babies, which will decrease the number of large babies, certainly, as the Cochrane review says, but it will also restrain the growth of normal-sized babies, and it'll restrain the growth of small babies. Second, a decrease in the number of women diagnosed with a situation called shoulder dystocia, which occurs during labour, and I'll explain more about that shortly. And thirdly, a decrease in the number of women diagnosed with a hypertensive disorder, high blood pressure, and I'll explain more about that in a minute as well. So growth, restrained, less diagnosis of shoulder dystocia, less diagnosis of hypertensive disorders, and that's it. That's the total to be expected from treatment of gestational diabetes. But here's the rub. It decreases these three diagnoses, but makes absolutely no difference to any bad outcomes that may be associated with these things. None at all. Hard to believe? Well, let's look in more detail. All right, a reduction in growth. In the first video, we found that gestational diabetes babies, on average, are about 119 grams heavier or bigger than non-gestational diabetes babies. And most of this extra size is not fat, most of it's lean mass. Okay, treatment decreases the size of gestational diabetes babies on average by 110 grams. And again, most of this reduction in growth is of lean mass more than fat. So it reduces the growth of big babies, all right, but also middle-sized babies. It also decreases the growth of small babies. It doesn't discriminate. You can't separate them. And we found that 3 to 4 months of treatment, multiple blood sugar tests for the mum, insulin for some women, gestational diabetes drugs that go straight through the mother, through the placenta into the baby for 3 or 4 months. All of this decreases the growth of baby girls by 30 grams, 2 level tablespoons. So certainly it decreases the number of large babies. So, for example, if you had a 4,100 gram baby and you decrease growth by 110 grams, you've got a 3,990 gram baby. Technically, a decrease in the number of large babies, definitely. If you have a 4,020 gram baby girl and you treat her for 3 or 4 months, that's 30 grams. She's 3,990, if I've got that right. Definitely a decrease in the number of large babies. Okay, but no reduction in any harm related to size. And remember that the reduction of the growth in the large babies is at the expense of the growth of normal-sized and small babies. They can't be separated. And even the large babies, how many of them are supposed to be the size they are? It's not that they're over fat. They may be more muscular. They may be taller. And remember, the reduction in treatment is mostly lean mass. Now, what about the second effect of gestational diabetes treatment, a decrease in the diagnosis of shoulder dystocia? Shoulder dystocia means that after the baby's head is born, the baby's shoulders don't easily follow. There's a delay. A number of what are called manoeuvres can then be used. So sometimes moderate or firm traction rather than gentle traction is all that is required. Sometimes other manoeuvres, such as asking the mother to flex her hips, sometimes rotating the baby's shoulders with the hand of the midwife, sometimes even bringing out the lower or posterior arm of the baby first. And other than a couple of minutes delay in the delivery, in almost all cases, or the vast majority of cases, there's no harm to either the baby or the mother. But sometimes it can be very, very serious harm. It can be a very serious situation. There can be injuries to the mother and injuries which can be quite severe to the baby, although that's very uncommon. But again, gestational diabetes treatment decreases the number of babies or the number of mothers who are diagnosed with shoulder dystocia, but makes no difference whatsoever to any harm or injury to the mother or harm or injury to the baby. What the studies show is that if 49 women are treated for 3 or 4 months for gestational diabetes, 49 women, one of those women won't have manoeuvres, won't have the diagnosis. And that's it. No difference in anything else. No change in injuries or harm to either mother or baby. Now, you may well think this is worth, gestational diabetes diagnosis and treatment, or you may not. Okay. Well, what about the third effect of treatment, a decrease in hypertensive disorders? Hypertensive means high blood pressure. Well, this sounds promising. So there can be really serious outcomes associated with hypertensive disorders. And right up at the extreme, there can be seizures in the mother, restriction of growth in the baby, prematurity, even stillbirth. These are all rare things right up at the extreme end. But again, in most cases, hypertensive disorders are just measurements. Their blood pressure is measured at over 140, the top measurement, or over 90, the bottom measurement. And in most cases, the mother's totally unaware of the blood pressure. It's just a measurement. Unfortunately, gestational diabetes treatments makes no difference to any of the bad outcomes that can be associated with hypertensive disorders. Treatment makes no difference to anything, any bad outcomes. All it does is decrease the number of women having a measurement. So if 10 to 20 women are treated for 3 or 4 months, one of those women won't have a blood pressure measurement twice of 140 or 90. And that's it. As a matter of fact, it's quite possible, and in my opinion very likely, that the decrease in hypertension disorders with gestational diabetes treatment has nothing to do with the blood sugar levels or the treatment. It's because these mothers tend to gain less weight during pregnancy because they follow a very healthy diet. And, a decrease in weight gain in pregnancy has clearly been shown to decrease hypertensive disorders. Well, that's pretty much all there is to say about the benefits of gestational diabetes diagnosis and treatment. It's been a pretty short video, hasn't it? Some might say the evidence shows no meaningful benefits arising from gestational diabetes treatment. I make no comment. That's for you to decide, and expecting parents to decide for themselves. In the next video, we'll look at what we are told by experts and health authorities to see if their advice is in accord with the evidence. In other words, whether what they tell us is true. Let's hope it is. We'll see. After that, we'll have a video about the potential harms of treatment, which of course has to be weighed against the expected benefits. Leave a comment if you feel like it. Thanks for watching.